This is an in-service training program presented by Nutrition Care Systems. Today's topic, nutrition and hydration in the elderly. Today's learning objectives are to list reasons elderly are at risk for dehydration and to understand how risk factors and changes affect nutritional status. Why are the elderly at risk for poor nutrition and inadequate hydration? And that would be because of many chronic diseases they may have, sensory loss that comes along with becoming elderly, eating dependency, dementia, depression, many medications, and also changes in GI function such as dental problems, constipation, or changes in absorption of nutrients. There's also a decrease in metabolic rate, decrease in cardiovascular function, a decrease in renal function, also in neurological function, and decreased energy expenditure. So how do these risk factors and changes affect nutritional status? There's a decreased interest in food due to decreased sense of taste and smell, inability to chew food related to poor dentition, decreased absorption of vitamin D and calcium. There's an increased prevalence of lactose intolerance among the elderly, cognitive issues that affect meal intake and our interest in food, and a need for fewer calories due to a decreased metabolic rate and a decreased energy expenditure. What are some interventions to prevent inadequate nutrition? That would be liberalize the diets, make sure the resident doesn't have low cholesterol, low fat, low sodium type diets, make sure they maybe just get a general regular diet. Fewer restrictions can often equal increased intakes. Provide texture modified diet if it's needed, recommend multivitamin and also supplemental nutrition if it's needed. Also provide lactose-free milk if they're lactose intolerant. Evaluate the need for setup or cueing, feeding, etc. related to changes in cognition, and then provide nutrient-dense foods that limit empty calorie foods to prevent unwanted weight gain. How does dehydration occur? It occurs when you lose more fluid than you take in and your body doesn't have enough water and other fluids to carry out its normal functions. Water is often the overlooked essential nutrient. We must have water for maintaining blood volume, for regulating body temperature, for transporting nutrients to body cells, for maintaining moist mucous membranes and tissues, for cushioning the joints, and it also protects the body's organs. It's also needed in that digestive process, also to carry waste products out of the body and to rebuild cells. Conditions that can increase the risk of dehydration would be fever, infection, confusion or dementia, constipation, diarrhea, vomiting, draining wounds, or a decrease in ADLs. Other conditions would be elevated environmental temperatures, medications, especially diuretics, inability to drink by oneself, high protein diet, or dysphagia. The signs of dehydration would be rapid weight loss, dry or sunken eyes, dry mouth or mucous membranes, changes in mental status, fever, vomiting. Other signs would be concentrated urine or decreased urine volume, dizziness, or an increased combativeness or confusion. So interventions to prevent dehydration also include know how much fluid each resident needs. Usually that's 30 milliliters per kilogram of weight. And you can see on the slide, 100-pound person needs about 5.5 cups of fluid a day, whereas a 250-pound person needs about 14 cups per day. And then there's additional fluid needed with diarrhea, vomiting, and fever. Also offer the resident fluids frequently throughout the day, such as at med passes before and after personal care. Provide early morning beverage carts, provide midday hydration carts, or even evening beverage carts. offer extra fluids on meal trays, offer ice chips, ice cream, fruit ices, soups, gelatins, and other foods that have a high fluid content. Monitor your at-risk patients for physical signs of dehydration. Refer them to speech and language if patient appears to have any kind of difficulty swallowing. Recommend any adaptive equipment for eating and drinking if that's appropriate and would help. Report signs or symptoms of dehydration to the nursing staff, and then care plan any resident at risk for dehydration. And simply keep water pitcher where the resident can reach it. Of course, if they're on a fluid restriction, you'd want to adjust that. But when a resident, you're going to be offering them water, make sure you take a direct approach. Instead of, "Here, Margaret, would you like a sip of water?" say, "Here, Margaret, take a few sips of water." Let's take a short quiz on nutrition and hydration in the elderly. Question number 1. Why are the elderly at risk for poor nutrition and inadequate hydration? A, dementia, B, depression, C, chronic diseases, or D, all of the above? And the answer to question number 1, why are the elderly at risk for poor nutrition and inadequate hydration? And that would be all of the above: dementia, depression, chronic diseases, just a few of the areas that make a resident at risk. Question number 2, how do these risk factors and changes affect nutritional status? A, increased absorption of vitamin D and calcium. B, need for more calories due to increased metabolic rate and increased energy expenditure. C, increased prevalence of lactose intolerance. Or D, increased interest in food due to increased sense of taste and smell. And the answer to question number 2, how do these risk factors and changes affect nutritional status? And that would be C, there's an increased prevalence of lactose intolerance. Question number 3, what are the signs of dehydration? A, rapid weight loss. B, fever. C, vomiting. Or D, all of the above? And the answer to question number 3, what are the signs of dehydration? And that would be D, all of the above. Question number 4, true or false, dysphagia does not increase the risk of dehydration? And the answer to question number 4 is false. Dysphagia does increase the risk of dehydration. Question number 5, to prevent dehydration, offer fluids frequently throughout the day. Med pass, before and after personal care activities, and before bedtime. The answer to question number 5, of course, is true. To prevent dehydration, offer fluids frequently throughout the day. Thank you for your participation in today's program. Our goal is for you to use this information in your daily work. We hope you are well served today and every day. If you would like more information about our in-service training programs or dietitian consulting services, please contact us at 800-761-9200 or nutritioncaresystems.com.